The New York State Office of Health Insurance Programs Medicaid Dental Team would like to share common barriers to timely prior authorization processing. The goal for this presentation is to improve the submission process and expedite a determination. We identified the biggest obstacles to timely determination and found that not receiving information the first time around and needing to generate a request for missing information is common. We find that accurate pretreatment charting, complete treatment plan, and mounted images of good diagnostic quality are frequently missing. One item that is most often missing is the required evaluation of the dental implant patient form. We cannot issue an approval without it. Let's break this down a little further. All fields on this form must be completed. Medical history should be pertinent, clear, and concise. It is important that you detail medical necessity, include a succinct dental summary to be considered. Simply stating that something is medically necessary is not an automatic qualifier. Address the overall status and prognosis of the entire oral cavity. The presence or absence of 8 points of natural or prosthetic posterior occlusal contact, or 1 missing maxillary anterior or 2 missing mandibular anterior teeth, is taken into consideration when determining medical necessity for implant-supported tooth replacement. It is important that you detail the reason other covered functional alternatives for prosthetic replacement cannot be used. The required evaluation of the dental implant patient form is found on the dental manual page on eMedNI. Here you'll also find the most up-to-date dental policy and procedure manual, current fee schedule with frequency limits, and other useful information for providers. This page also has a link on the right side to sign up for the listserv. Providers are alerted to changes through a dental eMedNI listserv email. So if you've not already done so, please sign up to be sure to receive timely notifications. The eMedNI listserv is a supplement to the Medicaid Update, which is the official newsletter of the New York State Medicaid program. Sometimes the prior approval request form itself is missing information. Here's an example of a paper submission. Electronic submission has the same information requirements. Several fields on the prior authorization request form must be correctly filled out or the system will reject the form without review. These include the client ID or SIN number and the provider ID number. If the order date falls after the date we received the form, the system will reject without an opportunity for review. Fill out the tooth chart with missing teeth, existing work, and planned treatment. The pink lines on the upper half of the form are where you list treatment that does not require prior authorization. Please address all pathology. The treatment you would like us to review for prior authorization should be listed on the bottom of the page. In this example, codes for a mandibular implant-supported overdenture. If the total amount requested field is left blank, the system will reject without an opportunity to review, so it's important to complete that field. Here's another example of a prior approval request for an implant, this time a single-tooth implant and abutment-supported crown. Any treatment that does not require prior authorization should be listed on the pink lines. Here, a couple of composite resins and an extraction. Treatment requiring prior authorization should be listed on the white spaces below. As a reminder, single-tooth implants have specific criteria for coverage, as often another covered functional prosthetic replacement will correct the patient's dental condition. Please review the Dental Policy and Procedure Manual for more detail. Remember to add remarks to the space indicated at the center of the page. In this example, the patient has a neurologic disorder and the provider has attached the required implant form along with documentation of contraindication to a removable prosthesis. Again, the claim will reject if the SIN, provider ID, order date, or amount requested fields are not completed correctly. The Dental Policy and Procedure Manual includes a prior approval checklist. Please use this as a reminder of what information should be included on all prior authorization submissions to avoid unnecessary delays. Though they don't replace required documentation, a narrative or two-dimensional photographic images can serve as additional supportive information when submitting an initial implant request, enhancing the information you wish us to know about planned treatment. Prior authorization requests should be processed before initiated treatment. In the rare occasion this is not the case, please provide a narrative detailing the reason and history. Please also note, prior to initiating treatment approved by a third-party insurance plan, the provider should obtain prior approval from Medicaid to ensure that the treatment plan falls within the current guidelines of the New York State Medicaid program. Failure to do so may result in the denial of Medicaid benefits for these services. Our mission at the New York State Department of Health is to protect and promote health and well-being for all. As you know, oral health is an essential part of overall health. We value your commitment to reduce and prevent dental disease in our members, and we appreciate the time you spent with us today. The address for the eMedNeed Dental Manual page is shown here. It's where you'll find the manual, evaluation of the dental implant patient form, fee schedule, as well as a link to the dental listserv sign-up. Information for subscribing to the Medicaid Update, the free official newsletter of the New York State Medicaid program, is provided here. And please don't hesitate to send questions to us at dentalpolicy@health.ny.gov. Thank you for listening. We hope you found this short session worthwhile.